All right, here we go. 4 days passed since surgery. Very swollen, but
this video is going to piss a lot of people off because there are going to be lovers, there are going to be haters, there are going to be people who freak out, there are going to be people who don't give a shit. This is a controversial area in plastic surgery because this gentleman clearly has had some pretty major skin reduction surgery, likely after losing a lot of weight. What he is showing represents the area of controversy in skin reduction surgery. So what are all those big red bulbs he has just hanging off of him? Those are bulbs that collect fluid from drains that are left inside his body after skin reduction surgery. What? I'll tell you. So looking at him based on the garments that he's wearing and based on the bulbs and drains and stuff that he has, let me first tell you what he did, and then let's talk about how different surgeons take care of these patients after the fact, okay? Very likely, willing to bet some good money on it. This guy had gynecomastia surgery, so reduction of skin and or breast tissue in his chest. He likely had a lower body lift, which basically means a tummy tuck where they reduce loose skin in the front and tighten his abdominal muscles. And this tummy tuck likely went all the way around his body, so it lifted up his butt. It got rid of a lot of loose skin down in the lower back area. His surgeon likely put one plastic tube, a drain, in his chest. I'll tell you why in a second. He put one in the other chest. He put 1 and 2 in the lower abdomen, and then he put 1 and 2 in the lower back. That's 6 drains, and that will correspond to those 6 bulbs that he has in there. So why the hell do you put drains in after surgery? This is a time-tested modality of reducing postoperative complications. Why? Okay, when you do a tummy tuck, when you do one of these surgeries, very often you lift up the skin off of the body. You reduce a lot of skin, you pull things tight, and then when you're done, underneath the skin, there's kind of this empty space that normally is stuck down and adherent to the body, but right now, because you did all this crazy surgery, it's lifted up, there is a space there under the skin. So a lot of surgeons will put drains in there, these plastic tubes, in order to collect the fluid that the body naturally throws into those areas as a response to the surgical trauma, okay? So the thought is, if you don't put those drains there, the fluid collects underneath your skin and then it can't get out. And it literally looks like you got like a water balloon or something underneath your skin. It can get infected. It can be a big problem. The traditional way is to put these plastic tubes in there, allow that fluid to drain out, and then eventually your body just sticks everything down, problem solved. That's how we've done it for decades. That's not how everyone does it anymore. There is a big move, or has been for years, to say, we shouldn't put drains in. To the point that some surgeons say that those drains actually irritate the body and cause that fluid to come in there and cause seromas. So what they do instead is, internally, they will suture the skin down to the muscles underneath and close off what's called that dead space and say, you don't need this. You don't need drains. And those guys get pissed off if they see that anyone has a drain. And it's almost culty, because if you don't do a drainless tummy tuck, a drainless body lift, a drainless this, a drainless that, they look at you like you're some sort of backwards idiot. Chill, guys, it's okay. Just relax. In my experience and in my practice, I do both. For my smaller gynecomastia surgeries, I don't put drains in. For my lower back lifts, the part that goes around the back, I never put drains. For my tummy tucks, I used to put drains, then I went into drainless, but now because we do so much aggressive liposuction with our tummy tucks, I went back to putting in drains because I felt that the complication rate was simply too high. Look, I know, and I dare say I'm very good friends with a lot of the guys who are big advocates for drainless. I'm good friends with the guys who are big advocates for drains everywhere. And you know what? Who cares? It doesn't matter. You know why? The only thing that matters is, what is the result that they give to you for the procedure that you come to. If the results are good, if the outcome is good, if the experience is good, who cares about a drain? Just go for the good doctor, go for the good result.